All right, we are talking about some adult things right now, so you might want to get the kids out of the room if you could for us. And on today's Sex Talk, we're bringing you some alarming findings about HRT, or hormone replacement therapy in women's health. Dr. Irwin Goldstein from San Diego Sexual Medicine is here with the findings. Good morning to you.
Hey, Erica, thank you always for
doing this.
We
really
appreciate
you.
It.
We appreciate it. So let's talk about this report that's come out that says HRT, or hormone replacement therapy, the avoidance of that can actually lead to early deaths.
Yes. So I think two steps backwards. It's the year 2002. There were millions of women on hormones, and then a report sponsored by the National Institute of Health said that we have to stop this study where people are taking hormone or placebo because there were too many side effects with the hormone treatment. Okay. And millions of women stopped. The media immediately responded. It was a widespread response. It was sort of overblown, and it was a persistent negative response against hormones. So now it's the year 2002. Now it's the year 2013. Millions of women have stopped in their menopause hormone treatment. Hormones are really important. Your bones, your skin, your muscles, your many other organs, of course your sexual organs, your mentation, how you have memory are all related to hormones. But these are women not on any hormones into their menopause. So they look now 10 years later to see how many people died early because of what we call estrogen avoidance. Over 45,000 women have died early in this era of estrogen avoidance because it's not logical. Estrogens are very important. The risk of breast cancer with estrogen is 1.26. That's the relative risk. If you smoke, current smokers have a higher risk of breast cancer. Obese women, so someone who's 5'4" and weighs more than 185 pounds has a higher risk of breast cancer than those on hormones. Alcohol use, 2 drinks per day, has a higher risk of breast cancer. My point is, it's not just about hormones being evil, it's more about hormones being good.
What do women out there need to say to their doctors? What kind of conversation do they need to be having with their doctors?
This is the year of the woman. It's time to be empowered. And you say, you know something? I'm not doing well. It hurts. I'm dry. I have back issues. My brain isn't remembering things. I get moody. I could go on hormones. Please monitor carefully. Please use what's called biologically identical hormones. Help me. Do this logically and rationally.
If a woman has, say, been off of the hormones for a number of years because of all those factors that she was worried about, and she starts them now at this point, do we know yet if that damage can be undone or if it will help to go ahead and start?
That's a fabulous question. The data are when you start later, you have more risk. So I think maybe the message is for those people just entering menopause, please don't use the data from the WHI, this Women's Health Initiative. The data for women starting in the perimenopause and early menopause is of benefit. They have less breast cancer, less heart attacks, strokes, etc.
And they can tie this directly and figure out that these women could have lived longer had they been on this replacement therapy?
That's correct. That's the sad part. So
yeah.
45,000 people died early to avoid a minute chance of getting breast cancer, that many other things are causing the breast cancer. Wow. There's also other stuff. Today, just got a new paper about testosterone. Everything we talk about with women is estrogen. Testosterone is a very important hormone too. So today, a paper just came out that taking testosterone lowers the risk of breast cancer and provides people with muscle strength, interest in sex, you know, sort of things that are very positive. So add that to the soup of hormone treatment. Not just estrogen, it's estrogen, testosterone, and it's, of course, progesterone. And more other things are happening. In 10 days, the Food and Drug Administration makes a decision on the pink Viagra, the first ever pill for sexual low interest problems.
And we're going to have you back then, I'm
I am
sure,
going
and you'll
to
be
be here in
celebrating.
4 seconds,
You'll bring
yes.
the party hat and the whistles and the whole deal.
It's really very good. Addy, the name of the drug is ADDYI, called Addy. So people will be taking Addy if it's appropriate for them.
Very good. You're wearing the pink tie and all,
Yes.
in hopes, I'm sure, that it will pass. Dr. Irwin Goldstein, thank you so much for being here as always.
Thank you, Erica.
If you would like to get in touch with Dr. Goldstein at San Diego Sexual Medicine at Alvarado Hospital, all you have to do is visit our website, fox5sandiego.com. Just click on that Scene On tab. All right, Raul, let's send it on back over to you.